Hi, today I would like to present a case study of the cardiac blood flow. Josie, a 43-year-old former college athlete, is experiencing shortness of breath and decides to see her doctor. After a few examinations, the doctor refers her to a cardiologist who looks into her results and tells her that she has congestive heart failure. In order to help her better understand the disease, the doctor explains the anatomy of the heart and its functions. The right side of the heart has two chambers that are known as the right atrium and the right ventricle. The left side of the heart also has two chambers, known as left atrium and left ventricle. There are four valves that connect the chambers with each other: tricuspid valve, pulmonary semilunar valve, bicuspid valve, and aortic semilunar valve. The deoxygenated blood, also known as the oxygen-poor blood, enters the heart from inferior vena cava and superior vena cava into the right atrium. The blood moves to the right ventricle through the tricuspid valve and into the pulmonary trunk through the pulmonary valve. The deoxygenated blood moves out of the heart to the lungs through the pulmonary arteries. The exchange of blood happens in the lungs, and the oxygenated blood, also known as the oxygen-rich blood, enters from the pulmonary veins and into the left atrium. The blood moves to the left ventricle through the bicuspid valve and pushes the blood to the aorta through the aortic valve and out of the heart to the rest of the body. There's a difference in the oxygen content of the blood on the two sides of the heart, because blue color represents the oxygenated poor blood and red represents the oxygenated rich blood. In other words, blue is blood with low oxygen and red is blood with oxygen. The doctor continues with the teaching and tells her about the difference between the pulmonary circuit and systemic circuit. The pulmonary circuit moves the blood from the heart to the lungs and transports the deoxygenated blood to the lungs for exchange between oxygen and carbon dioxide and moves the blood back to the heart. The systemic circuit transports the oxygenated blood from the heart to the rest of the body. The left side of the heart pumps harder because it contains the oxygenated blood that the left ventricle pumps out of the aorta and to the rest of the body. The left side of the heart also weakens fast and fails first because the left ventricle is the main pumping source of the oxygenated blood, and the left ventricle has to work harder to supply blood to the body. To better understand what the doctor said, Josie asked more questions. One of them was, if the left side of the heart fails, where in the circulation would blood back up? What about the right side? An answer to her question is that if the left ventricle fails, the blood backs up in the lungs, and if the right ventricle fails, the blood backs up in the vena cava, attempting to return blood to the heart. The blood flow in the systemic circuit would decrease if the left side of the heart fails, because the left ventricle does not pump sufficient amount of blood into the aorta. Blood flow into the pulmonary circuit would decrease if the right side of the heart fails. The pressure in the blood vessels where blood is backing up could cause rupture or leakage. It could also cause the blood clot to form, blocking blood flow and causing stroke. The doctor also explained to her that if the left ventricle fails, the blood backs up into the lungs and causes pulmonary edema, which means the swelling of fluid in the lungs. If the right ventricle fails, the blood backs up to the vena cava and causes general swelling of the fluid and enlargement of the liver. The heart is often referred to as congestive heart failure because of the extra fluid in the circulation that builds up around the heart and causes it to pump inefficiently. If the left side of the heart fails, the heart can't pump enough blood to the body, and the right ventricle moves the used blood from the heart to the lungs to supply oxygen, but loses the ability to pump a lot of blood, which causes a backflow into the veins. Another thing to know is that left-sided heart failure is the primary cause of the right-sided heart failure, because as the left side of the heart chambers loses its ability to pump oxygenated blood to the body, the blood continues to flow back into the lungs and causes the right side of the heart failure. One of the symptoms that led Josie to see her doctor was shortness of breath because the pressure in the veins during the backflow of the blood in the lungs increased and the fluid is pushed into the breathing space, which interrupts the normal flow of oxygen and causes shortness of breath. After understanding the anatomy and functions of the heart, Josie still couldn't understand why she had congestive heart failure when she has been living a healthy life with no history of any heart condition. This is when the doctor tells her that it was because of narrowing of bicuspid valve and a possibility that she was born with it. The narrowing of bicuspid valve prevents the valve from opening fully and reduces or blocks the blood flow from the left atrium to the left ventricle and to the rest of the body. The left atrium has to work harder to supply a lot of oxygenated blood to the left ventricle so it can pump blood out of the heart. It's the same with if the pulmonary semilunar valve was stenotic. The right ventricle would have its workload increased because it needs to pump oxygen, pour blood out of the heart to the lungs so that the heart can deliver the oxygen-rich blood to the body. The stenotic valve increases the risk of heart failure because if the valve is blocked, the heart needs to work harder to pump blood, which can cause weakening of the heart muscle and lead to heart failure. If Josie's case, congestive heart failure was caused by stenotic bicuspid valve. However, other valve abnormalities can also cause heart failure. The valve regurgitation is a name for leaking heart valve, which can cause the heart to work harder and may not allow the heart to pump the same amount of blood to the body and lead to heart failure. Thank you.